The first suggestion I would have is kind of on the emotional side. So men are weird. I can say that because I am one. And so men don't like to show that they're worried or upset. At least some of them don't. So I'm quite happy to do that. So, you know, if you see the man in your life kind of preoccupied and drifting away, or they got a short fuse, I mean, naturally, you know, maybe because their prostate cancer and their treatment are on their minds. So, you know, every man's a little bit different in terms of how you bring these things up, but that would be one thing to be prepared for. In fact, most partners and daughters and things are kind of dealing with that already, because that sort of issue comes up with the diagnosis in the first place. But it can come up more as it kind of comes home to roost, and that's often around the time they're actually having the treatment. And then, of course, there can be fear and upset surrounding the treatment itself, so it'll kind of come back again. But also, you know, I mean, however you think it's appropriate, but encouraging him to mention those issues to us, because they may not. So that would be the second thing. The third thing is modeling that, you know, you aren't necessarily as concerned about the future impact on sexual functioning as the man is. Now, mind you, you may say that and he's still worried, but in any case, sometimes the man in your life will be worried about it because he thinks you are. So spouses and partners can kind of, in whatever way is appropriate for that individual, keep the communication lines open on that issue, because that's often something men are really fearful about, not necessarily for right away during the treatment, because usually with radiation the sexual functioning isn't affected right away. It's years, months and years later. But nevertheless, that's on the man's mind. You know, it's all about the erections and stuff. So kind of being aware of that, and, you know, gently kind of keeping the lines of communication open on it. And being open to exploring solutions as well. Because some couples are quite private, both of them, actually. So it's kind of a new thing to learn to talk about it. And then also helping facilitate the logistics of the treatment as well. You know, because I would say a side effect and part of the recovery is sort of inconvenience, and getting through the treatment phase, the driving and everything else, helping be the person who coordinates the drives from friends and all of that is a hugely helpful thing. So those would be the main suggestions on the side of daughters and partners and other people. I guess what I would mention there is, if, you know, that's a hard thing, and it can be, take advantage of the advice that's available. So beginning with me, but also the interprofessional team I work with, including the nurses. There are all kinds of other people meet when they come to have treatments with us. And there is our patient and family counseling department, really helpful, and I can't stress how helpful they can be on the decision-making side as well. But helping you help the man in your life get through this is an important thing.